All right. Hi, everyone. My name is Christina McGuire, and I'm the internship coordinator with the Career Center at Santa Barbara City College. And today we're going to hear from Haley Higgins, who is from Cope Health Scholars, and she's going to talk about all the great opportunities to really get hands-on experience in the healthcare field. So I'm going to stop sharing my screen and have Haley take it from there.
Hi, everyone. I'm going to share my screen now. Awesome. Okay, can everyone see it?
Yep.
Awesome. So hi, everyone. Again, my name is Haley Higgins, and I am from the Cope Health Scholars program at our St. John's hospitals. So cool thing about our program is actually we have two hospitals that scholars can shift at, one in Oxnard and one in Camarillo. I am currently a health scholar, so that means I shift on the floor in different departments. And I'm also part of leadership team. So I'm the director of recruitment and enrollment, and I get to do these really cool things, such as presentations and speaking to different students about the program. So this is kind of an overview of everything we're going to touch on. So I just did the introduction. We'll do a quick program overview, what our enrollment and training process looks like, the program commitments, experiences, and benefits, about our hospital site, some application tips, next steps, and some question and answers. So Health Scholar in Action, this is just a video. I won't click the link, but you guys can always copy and paste it and check it out. So a big part about Health Scholars is that we get to shift on patient floors alongside healthcare professionals, and we get direct hands-on patient care. You guys are trained to do several skills on the floors, and so that's what leads to your hands-on patient care experience in the program. Our COVID-19 response, a lot of people are concerned about their risk of COVID-19 or contracting the virus while shifting in the hospital. At Cope Health Scholars programs, our main priority is to keep our scholars safe. As everyone knows, COVID is a very fluid situation. There's lots of changes happening each and every day. Some things that we've done at our site specifically to help minimize the contact is we stopped having scholars go into isolation rooms. So obviously scholars are not allowed in COVID-19 rooms, but they're also not allowed in any contact or droplet rooms. We also provide PPE to our scholars. So every day you can get a hospital grade surgical mask. When you walk into the hospital, you get your temperature taken, and we provide you with safety goggles. So while you're shifting on the floor, you're extra safe. And along with that, we consistently check in with our scholars. We offer them new insight to the development of the pandemic and what the CDC recommends. So our Health Scholar program, so this is just a general overview of what the program is. So we have committed students in different health professional pathways, and this is an experiential program through the Keck Graduate Institute. All our students are pre-screened via application, interview, health screening, and 30 hours of training. This 30 hours of training might sound a little scary. However, it's kind of split up between didactic learning and hands-on practicals. So what our scholars do, they commit 280 hours in the program, and you're required to shift at least one 4-hour shift a week. So depending on the different tracks, which we'll get into in just a minute, you can shift anywhere between 4 hours a week to roughly 20 hours a week, just depending on what you want to do and how fast you want to complete the program. So we offer 3 different tracks. We have a 9-month track, which is where scholars shift twice a week in 2 different departments, a 3-month track where scholars shift 5 to 6 times a week in 2 different departments. And then we also have a 15-month track where scholars shift once a week in 1 department. So we do provide firsthand healthcare experience in a variety of departments. Between our 2 hospitals, we have 27 departments that health scholars get to choose from. So they definitely get a lot of experience in different areas. We engage students in organizational key initiatives, provide professional development and mentoring, both in our program specifically, as well as our COPE network. We connect students with entry-level hospital and health system jobs. So a really special thing about the COPE Health Scholar program is that we do give our scholars a heads up if our hospital is hiring. Our hospital loves to see health scholars that eventually graduate the program and begin working as CNAs or go to school and then come back working as nurses. And the program also helps develop healthcare leadership from the community. So as I said, I'm on leadership team. A lot of professional schools like to see that you have some leadership experience. I specifically am part of the recruitment branch. So I do a lot of presentations and networking. And where do our scholars shift? They shift in inpatient clinical units and ambulatory settings, as well as administrative areas. So this is the role of a health scholar. So the three main things we do is assist, engage, and learn. So assisting on the floor, we help healthcare providers by doing those basic comfort care tasks, such as bathing, feeding, and ambulating. And of course, you guys are taught and trained as well as tested on these skills before we let you guys go on the floor, so you're well prepared. We also have our scholars round on patients. So they do have a rounding form that they fill out each time they go into the hospital. This helps them get a sense of what it's like to round on patients and address any concerns that patients have. We're very engaged as health scholars. So we enhance the patient experience by practicing compassionate listening. So a big thing about the health scholar program is that you really are practicing your patient care skills, especially those who are interested in going into the medical field. This is super cool to have that edge before you even apply to a program, so you understand what it really means to take care of a patient. We also greet visitors and assist with wayfinding, just helping people navigate throughout the hospital and make sure they get to the correct units. And then, of course, learning. So we engage in Cope Health Solutions platform for networking and mentorship. In our alumni realm, we have plenty of graduates of the health scholar programs that are now doctors, physician assistants, and nurses. And they come back and talk to our scholars about their time in the program and how that gave them an edge in their professional development. So the health scholar role below is like 4 different boxes about what health scholars can and can't do on the floor, as well as what they can do with the direct supervision of an RN. So the objectives are that they join the patient care team and support with providing customized one-on-one patient care. We also learn about different career paths within healthcare. A lot of people either solidify their career choice or find a new career choice just by shifting through different departments. I know for me, the Cope Health Scholar program specifically solidified my decision to become a physician assistant. I've met so many in my time in the program, and they've given me so much advice, and I've even had shadowing opportunities because of the program. So you can overview the different things that health scholars are allowed to do. So some things are rounding on patients, answering call lights, promote floor initiatives such as fall risks, educating patients on falls, greeting and assisting members or visitors. And some things that we can do that we don't need a staff member's presence required is patient vitals, feeding patients, ambulating non-fall risks. So that's essentially walking with patients and discharging patients. Some things that staff presence is required for are things like bathing and repositioning, as well as observing different procedures. And then some things that we're not allowed to do as health scholars include acting as a sitter, handling medications, and translating or interpreting clinical information. So enrollment and training. So here is a general overview of what training would look like, as well as enrollment. So you complete your online application, and then once you submit that, you're invited to a in-person / virtual interview. Right now, it is a virtual interview, but as COVID continues to stay present in the world that we live in, we're going to keep it virtual, and then we will let you know if that changes. Then we have health screening, clearance, and one-time tuition. So the clearance appointments are essentially when you come into the hospital and you submit all of your vaccines, your COVID-19 vaccine, stuff like your MMR vaccine, and then you have training. So this is a 30-hour training as well as examinations, both written and practical. Once you're in the program, you are continued to train before you enter different departments. So we have a quarterly department specific orientation and training. What that is essentially when you start on a new floor, you get trained in the floor. So you have someone who's shifted in there, walk you around, show you what you can do as a scholar, as well as what tasks are expected of you. And that helps you familiarize yourself with the department. And then you have 1 4-hour shift per week in that department. And then again, to graduate the program, you need a minimum of 280 hours as a health scholar, and then you can get your certificate, and you're also eligible for a letter of recommendation. So some program prerequisites: you have to be 18 years or older by the start of the program, have a high school degree / GED, or are currently enrolled and graduated from an accredited two-year college for your university. You must complete a health screening and background clearance, which is paid for once you enter the program. And you must have active healthcare insurance throughout the program participation. It doesn't matter what healthcare insurance you have, you just have to have proof that you do have one. So our program training. So this gets into how our training is split up. So we have our didactic learning, which is online modules completed remotely on different topics, which include program structure and policies, customer service, patient safety, and confidentiality. So that's all through online modules, which include videos as well as quizzes. And then you have patient care training, which includes patient comfort care skills and competencies, as well as practical scenarios in a patient care setting. So again, these are all online video modules that you'll be completing. And then you have your evaluation, so your competency evaluation, which is written and practical scenario-based examination. So you will have a multiple choice test, and you will be tested on one of these skills that we teach you as a health scholar. And we direct observation on units as well. So we have people in charge of our scholars that go and make sure that they aren't confused on any skills. And if they need refreshers, we do reach out to them. And then we have department-specific trainings and rotations. So again, the 280 hours is the minimum to graduate. We have different program tracks, so that just depends on how often you shift and how fast you complete the program. And then we have quarterly competency checklists. This just ensures that our scholars are prepared to be on that floor. So our training curriculum, I won't go through all of this stuff, but this is just an overview of what we teach you in your online modules. So we have patient care competencies, service excellence, leadership and management, as well as rule and regulations. So this is kind of all the background knowledge that we learn as health scholars along with patient care competencies. So we really learn how the hospitals run and evaluated on a much higher schedule, much higher level than you would just completing a basic program. So our program commitments, experiences, and benefits. So again, depending on your program track, so our 15-month scholars shift 1 4-hour shift per week, our 9-month scholars shift 2 4-hour shifts per week, and our 3-month scholars complete 6 4-hour shifts per week. And that's just how fast you complete the program. Another unique thing that we offer to our health scholars is that once they finish their 280-hour commitment, they can continue to shift in the program as long as they'd like. I started the program in January of 2020 as a 15-month scholar. I am still in the program more than 15 months later, and you don't have to pay any additional fees. We also have quarterly program meetings. This is just to make sure our scholars are up to date with any continuing education, as well as program updates. The 280 hours to complete the program, and then our tuition fee. So this is a sample rotation. So once you start as a health scholar, you start off in the tier 1 departments, which are pretty much all med-surg floors at St. John's. Then after you complete 48 hours or 1 rotation, you can enter into a tier 2 department, and so on and so forth until you get to tier 4. You can always pick a tier up from you going into your next rotation. And of course, you could pick any tiers below. So let's say you're in tier 3, you could pick any departments in tier 3, 2, or 1, but not in tier 4. And then the benefits. So once you graduate the program, you're eligible for a letter of recommendation. You do get a completion certificate from Keck Graduate Institute. This just has your hours that you've completed in the program verified and on a certificate that you can use for different professional schools, as well as any job applications that you need to fill out. And you have access to educational events, workshops, and priority benefits when applying to KGI graduate programs. So some educational events that are coming up for us that are open to all scholars include MCAT prep, I believe how to ask for letters of recommendation, and how to write personal statements. So that's coming up in the next 2 months. And then any health scholar in any of our programs are able to attend this event. We also hold workshops with different healthcare professionals, and they explain different skills that you need to apply for graduate schools. And we also have access to over 34,000 alumni through Cope Connect network. So again, our network's very large. Anyone that graduates the program is still in our network through our Cope emails. And we do have access to a variety of different scholarship funds, educational events and workshops again, as well as just building relationship with other healthcare professionals. So the benefits continued. So we have educational lectures and workshops focused on enhancing basic healthcare knowledge, quarterly workshops designed to provide professional development opportunities, quarterly workshops in partnership with the Princeton Review. This is a big one for a lot of our scholars is MCAT/GRE overview info session. A lot of people are always curious how these kinds of tests work, and as health scholars, we're very fortunate to have these resources accessible to us. Diverse career panels exposing scholars to different professionals. So this helps us understand all available roles in healthcare. A lot of people think of nurses and doctors, physician assistants, and nurse practitioners when they think of healthcare providers. But it's very cool that we're exposed to other professionals such as respiratory therapists, physical therapists, occupational therapists. So it really gives us an opportunity as scholars to ask questions regarding specific healthcare tasks and jobs. And then again, the access to the Cope Connect network. Okay, so about our sites. So we are part of the West LA realm. Right here is Adventist Health. This is in Simi Valley. So our presentation is general for our region. However, the closest health scholar program to you guys in Santa Barbara is us in Oxnard, but you can take a look at their different departments. And this is their program manager and recruitment coordinators as well. And then we have our Kaiser Permanente location in Woodland Hills. This is also a good drive from you guys. This is some of their departments and different opportunities that they have at their site, as well as contact information. And then this is my site, so St. John's Hospitals. Again, we have a hospital in Oxnard as well as Camarillo. Over here to the right is the different clinical departments that we offer. I am also the department coordinator of our rehabilitation unit at St. John's Regional Medical Center. So I oversee all the scholars shifting in that department. If you're not interested in clinical departments, but you're interested in going to pharmacy school, we also offer a pharmacy department as well as nursing education and our administrative track. And here's our contact information. So if you have any questions about admissions, this is the email to reach out to. If you have any questions regarding recruitment, you can reach out to this email and I will get back to you. And this is our program manager. Her name is Poryu Lim, and that is her email if you have any questions.